Good morning. I'm Kurt Caraway, and this is Our Town at Comma Coffee. This morning we're going to be talking with Stacey Belt from Carson City Health and Human Services about the Medical Reserve Corps. Right now we're going to take a short break for a word from our sponsor.
What's the role of a healthcare system? Is it to make you better when you're sick? To mend you when you're injured? At Carson Tahoe, we think it's more than that. That's why we've created an interactive website dedicated not to your illness, but to your health. Because as much as we care for our patients, your everyday health is even more important. Are you ready to live healthier? Start today at herestoyourhealth.net, a free service of Carson Tahoe Regional Healthcare.
And we're back. We're talking with Stacey Belt. How are you doing this morning?
I'm great. How are you?
All right. You work for Carson City Health and Human Services.
I do.
And one of the things you want to talk about is this Medical Reserve Corps.
Correct. I'm an emergency preparedness planner at Carson City Health and Human Services.
Just in case we have a big earthquake or something.
Exactly. Okay. Well, we're planning from a public health perspective because when you look at disaster relief or any type of disaster, there's always a public health component to it. So in supporting our efforts for a more resilient community, we've joined with the National Medical Reserve Corps program, and we've developed the Western Nevada Medical Reserve Corps, which incorporates Lyon County, Douglas County, and also Carson City.
All right. So how does this Medical Reserve Corps work? What is it? Well,
to put the entire thing in context, when we go back to the tragic events of 9/11, 2001, there were a number of people that felt helpless, and they wanted to respond. They wanted to make a difference. Communities really came together. People were handing out water, assisting the responders in their own relief. And the Medical Reserve Corps really became the brainchild with the events after 9/11. I don't know if you remember, but we had the anthrax scares down in the D.C. area. Media and politicians were targeted. And at that time, it was necessary to prophylax thousands of people against anthrax. Office of Surgeon General dispatched or deployed a number of medical professionals to assist in that effort. What they realized was they could handle a couple thousand. It was a little shaky to start with, but what if we had hundreds of thousands of people that needed to be treated? We needed to put together a volunteer corps in order to assist with that effort. So while the Medical Reserve Corps has a medical component to it, we also need people like myself who are not medically trained to assist in the logistics. And that's really where it came from.
All right. And so now doing it here, so how does it work here?
Well, in the state of Nevada, we actually have 4 active Medical Reserve Corps programs. We have one in Washoe County, one in Southern Nevada. We have a frontier and rural group, and then the best group is the Western Nevada Medical Reserve Corps.
And that encompasses, is it Carson City and
Lyon County and Douglas County.
Okay.
So we train together, we exercise or prepare together, we do simulation mock disaster preparedness exercises, and we work together not only to build our personal resiliency in our own homes, our neighbors, but then also to support the community.
Okay. So what you're saying is some people can have medical training or not, but it's all working for the same effort.
Absolutely. The Medical Reserve Corps, becoming a volunteer means that you're pre-credentialed and your background check is done. And then we're able to come together as a corps and work toward future response.
Okay. Well, thanks. We're going to take a short break right now, come back right after a word from our sponsor.
When you or someone you love suffers a medical emergency, the last thing you should have to worry about is the cost of the ambulance. That's why the Carson City Fire Department offers CC Care Plus, so you or your family don't have to pay any out-of-pocket expense. Just $50 a year per person or $75 a year for your whole family, as long as you reside in the area served by the Carson City Fire Department. All medically necessary and approved trips are covered to and from healthcare facilities, doctors' offices, and nursing homes. Sign up for CC Care Plus by calling 887-2389. Enrollments end June 30th.
And we're back, and we're talking with Stacey Belt. So now to be a volunteer, what does it take to be a volunteer? Because this sounds very interesting. I know there's a lot of people who might be
Well, we're actively recruiting, so I have to plug on June 29th at 5:30 p.m. at the Brewery Arts Center, the Artisans Cafe. We're having a recruitment party. We're going to talk a little bit about what the Medical Reserve Corps is and what it isn't. Medical Reserve Corps is not only for medically trained folks. I'm not medically trained. When we do our annual flu clinics, that's a preparedness exercise. So there are all those people that wield clipboards and pens and tickers and help the public while our professionally trained medical staff are screening and administering flu shots.
Right, so they don't have to deal with all the paperwork stuff and everything. They can just
what we do.
Move them in and out.
Absolutely. For Dynamic Corps, we really need both. We need students. We need retired professionals. We need those persons who want to know more about disaster relief and want to train and want to help to build a more resilient community. You know, when we look at our past, it wasn't very long ago in 2004 when we had the waterfall fires. We had the floods in January 1st of 2006. Those are community events.
So, yeah, and so everybody can come out and help, you know, with those to make sure we got medical things taken care of. Medical
things up to and including working closely with our CERT, our Community Emergency Response Team, on animal response. Okay. And then also, one of the reasons you want to form this this Reserve Corps is just so people don't just walk up and start doing stuff and you don't know if they're credentialed or not. Credentialed or if they're pedophile. Exactly. Right, we want people pre-credentialed. So you do a little background check on people and everything to make sure they're legitimate. They're who they are. And, you know. The volunteers that show up with good faith and good heart really are of no use to us at the time of disaster because we need to protect the community. So really the most important is signing up in advance, getting the appropriate training, learning the additional skills, and vetting through a background check. Okay. And then the training part, you know, you said that you do some training together, so you train on different pieces of this, and people can learn. Can people learn a little bit of, you know, first aid stuff? Is that kind of some of the things? First aid, psychological first aid, animal response training, incident command, so that we can fit into our emergency manager's overall response plan. Yeah, because I remember during the waterfall fire, there was a lot of people who wanted to help out with the animal response. You know, they had pastures or whatever, you know, things that they could take horses and stuff like that, but they didn't know how to respond, they didn't know how to get the word out or what to do, and so this would help organize this. Absolutely. We're building a robust team, including just those people that have pastures. We have their background and contact information so that we know if we're moving your animals to those areas that we're going to get them back. Okay, and then of course yeah, you want to get your I want my dog back. Right. And then of course you have, you know, the emergency responders around here know about you, so that the sheriff's department and the fire department and all those people, so if we do have a fire or an earthquake or something like that, they know who to call, they know how to get things done. So absolutely. And at the time of a disaster, we'll set up a volunteer coordination system, but it'll be days, if not a week, before we can do the background check so that we can put you into an integrated and coordinated response under the direction of emergency management. Right. So, okay. Well, sounds interesting. So tell everybody again exactly, you know, where we want everyone to come to the Brewery Arts Center, the Artisans Cafe, on June 29th at 5:30 p.m. to learn more about the Medical Reserve Corps. See if it's a volunteer opportunity that fits for you. It'll be a good time. We've got food, we've got information, we've got some great speakers, we've got our state MRC coordinator coming to meet everybody. So okay. Well, thanks a lot for coming on and telling everybody about it, and thank you for tuning in to Our Town at Common Coffee. We'll catch you next time.
Here's to peace of mind. That's what comes with Carson Tahoe's comprehensive cardiology services. Carson Tahoe Regional Healthcare. Here's to your health.